Hey, today's presentation's called Helping Hands Through Teamwork and Collaboration During the COVID-19 Virus Crisis. Um, this course is going to be a 4.5-hour course for the ambulatory pain block nurses that are going to be redeployed to unfamiliar units in the hospital setting, so they can be able to function competently as essential healthcare team members, collaborating in the care and decision-making of their COVID-19 patients. The purpose of this course is to create a patient safety initiative by ensuring that the nursing staff sent to the hospital is adequately trained and mentally prepared. The learners are 8 seasoned nurses who work in the pain block clinic department. The age of the participants ranges from 34 to 50 years. The learner's clinical nursing experience ranges from 10 to 22 years with various clinical backgrounds in medical surgical units, intensive care units, GI, post-anesthesia care units, and the emergency room. These nurses are associates and bachelor prepared registered nurses. This is basically going to be, this is basically an overview of the course and the target audience. The focus is, to support the nurses through the unknown of the COVID-19 surges that occurred during, the surges, the waves of COVID that resulted in the ambulatory nurses leaving their work settings to assist in the hospital. It occurred a couple of times. The nurses received notice that they were to report to the hospital the following day. Some were assigned as primary nurses to be in the emergency room and the ICU, and some were assigned as buddy nurses. They did not receive proper training, and some assigned as primary nurses had no recent ER experience. It was mentally devastating and very stressful for them. The objectives that I'm going to cover in this presentation are 3 from my lesson plan. Nurses will journal to express their feelings about going to unfamiliar departments. The nurses will demonstrate proper use of PPE as they feel, so they feel safe, comfortable, and competent while caring for patients who are COVID-19 positive. The third one is the nurses will integrate the knowledge that they gain through this course to advocate, collaborate, and communicate with the healthcare team, patients, and patients' families to provide the necessary care of COVID-19 patients for the care of the COVID-19 patients. They'll be able to listen and effectively communicate and use resources available to ensure that safe care is provided. The first objective regarding the journaling is something that helps, it helps with anxiety. Nurses can write down their concerns, their anxieties and fears, and hopefully this will kind of help be in touch with their feelings and decrease anxiety. According to Dimitrov, research indicates that journaling assists in the development of critical thinking. During this part of the lesson, the nurses will be given an overview of the department coverage each nurse will be going to and their role, what their role is going to be while they're redeployed. Most nurses will partner with the primary nurse who works in the unit as their home base to assist her with patient. Informational handouts will be provided to include the covering nursing supervisors, the charge nurses, phone numbers to keep handy, such as physicians on call, pharmacy, EVS, laboratory, and transportation services. Assessing the nurse's ability to express their feelings, we're going to be asking the nurses, 50% of the nurses, if they want to volunteer and share what they journaled. Allowing the nurses to express their feelings and anxieties and fears about working in unfamiliar, that will help them cope with such sudden managerial decisions to send them to the hospital. Many of these nurses haven't worked in the inpatient hospital setting for years, so it makes just a change even more challenging. Okay, the second objective, the nurses will demonstrate proper use of safe and comfortable while caring for patients who are COVID-19 positive. The nurses will watch a video on donning and doffing of the PPE via YouTube. Then the nurses will divide into groups of 2 for practice and return demonstration with a checklist of proper demonstration of the donning and doffing of PPE. The instructor will be using a checklist to check each nurse off. The third objective. This objectively says that everything that is learned through this course, they'll learn to integrate the knowledge that they gain so they can advocate, collaborate, and communicate with the healthcare team, patients, and the families to provide the necessary care of the COVID-19 patients. They'll be able to listen and effectively communicate and use resources available to them to ensure that safe care is provided. For this portion of the course, via YouTube on the Josie King story and a group discussion as my teaching strategies. The nurses will have the opportunity to reflect on the story and to discuss where the breaks in communication amongst the healthcare team led to unsafe delivery of care for Josie King, which cost her life. A mentoring hospital physician will be present to discuss inpatient case scenarios with a focus on team-based care and to clarify questions and concerns on safety issues. Nurses will be able to recognize that care does not fall solely on one person. There are a multitude of resources available, and if there's any questions or concerns that arise during a shift, nursing leadership is available, such as the charge nurses, nursing supervisors are always available to assist. All right, this is the conclusion of this video presentation. Thank you for watching.